Hi, my name is Veronica Wright, and I am the Executive Director and founder of the National Coalition for Drug Legalization. The mission is to advance the conversation about the legalization of all drugs through community service and research. Today's presentation will provide some background information regarding our research, followed by our research question, methods, and results. Finally, we will provide a statement for this year's INCB Civil Society Hearing. The National Coalition for Drug Legalization is a U.S. organization headquartered in Clarksburg, Maryland. We are made of national organizations who want to end the war on drugs through legalization and regulation. The coalition is responding to the devastating impacts on communities, such as violence, caused by the prohibition of drugs, and see legalization as an important way forward. One way we've understood violence to arise from prohibition is by the massive targeting of drug arrests. Scholars have long theorized that there is a relationship between drug arrests and violence. Criminologist Todd Clear's coercive mobility theory describes how drug arrests in areas where the drug trade and violence is more prevalent. This results in the continual disruption of communities' ability to create strong economic and civil society fabrics. This further results in people not being able to fully re-enter society as productive citizens following incarceration. In Baltimore, there has been a history of mass incarceration and gun violence. While making up just 9% of the state's population, Baltimore City represents 40% of the state's prison population. Although there has been policy changes and lawsuits such as the Department of Justice consent decree on the Baltimore Police Department, there has not been a significant drop in drug arrests or drug-related crime in Baltimore. The need for change inspired this research. We see drug policy reforms that are not working. The need for research to document the trends in drug arrests and violent crimes such as homicides during an era where the war on drugs has become a war on people. We hope to present new data to help policymakers, law enforcement, and the general public embrace a new way of viewing drug policy reform. There is an intense war on drugs in Baltimore and other parts of the country. Our research focused on crime data that was collected by the Baltimore Police Department. The goal is to understand trends in drug arrests and homicides in an effort to help us understand the impacts of the war on drugs and the limits of a drug policy approach that is not considering drug legalization. Our research team was made of university and non-university based scholars convened to understand and contextualize drug and violence-related trends. Our research questions sought to evaluate drug arrests and homicide trends between 2012 and 2019 and to assess trend differences between neighborhoods that had a history of mass incarceration versus those without this mark. We hypothesized that neighborhoods with a history of mass incarceration would have higher rates of drug arrests and homicides. We examined incident rates of both drug arrests and homicides for each year by neighborhoods with hyper-incarceration versus those without. After noticing a meaningful change in 2015, when there was an uprising protesting against police brutality after the death of Freddie Gray, we specifically examined drug arrests and homicide trends before and after 2015. Freddie Gray was an African American citizen who was a victim of police brutality. He died in police custody in 2015. We then calculated incident rates accounting for population level factors. We then calculated rates per year to assess disparities between hyper-incarcerated neighborhoods versus non-hyper-incarcerated neighborhoods. Our research suggests that drug arrests may have contributed to the conditions of increasing homicides throughout this period. Building on criminology theory, We see in our graphs to the left demonstrates in neighborhoods with a history of mass incarceration experience higher homicides. The graph on the right demonstrates in neighborhoods with a history of mass incarceration experience higher drug arrest rates. To explain further, drug arrests were going down when cannabis was decriminalized for medical use and homicides were rising steadily. Then, after the uprising, the drug arrests continued to decline at a much slower rate and homicide rates remained stable. The most poignant result is that disparities between the highest incarcerated neighborhoods remain the most impacted by the drug arrests and homicides over the time period, showing us the major impact of the legacy of mass incarceration. Our response to this year's INCB Civil Society hearing is that when you create an illicit market, you create the opportunity for violence associated with drug trafficking. Our data shows that neighborhoods suffering from decades of incarceration and disinvestment will fall prey to the lure of the street market. Selling drugs is often a way for many people with few job opportunities to make money. The drug war drives violence. We need a policy that will create a safe way to buy and sell drugs without the risk of criminalization. Thank you.